Angmar Medical Holdings, Inc. is a dynamic home healthcare company with offices stretching from west to east across the country. To date, we have served tens of thousands of individuals, delivering healthcare to each one with a degree of compassion and integrity embodied in our core belief statement: we serve patients. In the more than 15 years since its inception, Angmar has gone from a single agency to multiple locations in Arizona, Colorado, Florida, Iowa, Kansas, Michigan, Nebraska, Ohio, Oklahoma, and Texas. The agencies under the Angmar umbrella are Angels Above Us, Angel Care Health Services, Angels Care Home Health, Crown Health Services, Family Care of Texas, and Specialty Nurses. Angmar is still growing strong. With such reach and momentum, you might not know it had humble beginnings founded on a dream of service. In the year 2000, Texas couple Angie and Mark Eddins were already busy raising 4 daughters, but they wanted to serve seniors living in rural areas with limited access to health care. So they purchased a home health care agency in Nacogdoches, and the Crown Health Services brand was born. Shortly after this acquisition, they bought another agency in Wichita Falls and launched their second brand, Specialty Nurses Home Health. As they served patients through these first 2 agencies, their dream gained traction, and they brought into the company Family Care of Texas and Angels Above Us. 2 years later, they added another, Angels Care Home Health. Such explosive growth naturally propelled expansion of the company headquarters. Originally based in Arlington, Texas, the corporate offices were moved 6 times to accommodate increasing staff, additional agencies, and the agency's branches. Finally, the Eddins purchased 9 acres in Mansfield, Texas, on which to build a headquarters for their expanding company. The new facility opened in 2009, the same year they introduced their 6th brand, Angel Care Health Services. Angmar's rapid growth is due in part to a demand for healthcare services among our growing and aging population. Patients are most comfortable receiving state-of-the-art care in their own home. But this growth is also a testament to a visionary corporate leadership and a standard of excellence among those individuals who make up the company's field staff. Without the day-to-day work of the managers, clinicians, and office staff in the field, Angmar would not be what it is today.
My involvement in nurses started when I was in college. I got a job at the Enid State School where I was caring for individuals with mental and physical disabilities. I worked in the recreation department. Soon after, I got another job in a similar field where I was helping individuals with disabilities as well. My real inspiration for this career field was my grandmother, who was a nurse. We always looked up to her. She had a position in which she cared for people and individuals and had the opportunity to make a difference in their lives. Back in 1998, I went to work for a company in Wichita Falls, Texas. I became their RN case manager and director of nurses. In 2000, Angmar Medical Holdings acquired that company, which gave me an opportunity to advance and for my career to evolve. So when I first came to Angmar, I was an administrator. Then soon after, I became a regional director, then a vice president, and then 6 or 7 years ago, I became the chief operating officer. What makes Angmar strong is our people, our administrators and our branch managers that put together the great teams that serve the patients in their homes. This is what makes Angmar strong.
This is a sentiment echoed by other members of the corporate leadership.
How I first got started into nursing was in high school. I took a job at a nursing home, and I was actually feeding patients. A few months later, they let me start transporting patients. A few months later, then I became more companion, reading books, spending time with the residents there, and that particular job led me to really understand that was my passion. Nursing was my passion. And in 2002, I moved to Texas, and ironically ran into one of the owner's daughters at a swimming pool party. And she saw me reading the newspaper, and she asked me, what are you doing? And I said, well, I'm looking for a job. Well, what kind of job are you looking for? I said, well, I'm a nurse. And oh, my mom and my dad hire nurses. Since I was hired at Angmar, I served as the Director of Nurses for Family Care, the Administrator for Family Care, Clinical Regional for all of Texas and at that time. That's where we began putting offices in. And then Mark and Angie put enough trust in me to oversee the clinical operations for Angmar. When I'm coaching staff, the two key components are integrity, so that we have credibility for taking care of patients as a company, and passion, that our nurses are able to deliver passion in how they work with our patients.
I'm not saying anything bad about the other home health care that I've had, but they're just not like this one. Elaine has changed my life just by listening to my problems, and just telling me that she's here when I need her, if I should happen to need her, that she's always here. And I believe that. I believe that with all my heart.
For some patients, that Angmar nurse delivers more than medical care. That nurse is a source of psychological and emotional support during the healing process.
Without Carolyn, she gives me the motivation to do what I do. She gives me the motivation to be sitting in this chair, to get up, do for myself, do as much as I can for myself. I want people to know that Carolyn is a person that cares. She's not just a nurse coming out to do her job. She's coming out to do her job and to show you that she cares.
My career has been like the Forrest Gump of home health. When I came to Angmar, I had already been a home health nurse, a home health salesperson, a home health sales manager, a branch manager, and then I was in a role of consultant. And they had asked me to come speak at their corporate conference. When I met them, I fell in love with the team. I knew they worked hard and they had the passion for what they did. I think one of the unique things Angmar agencies can do going forward is go into the patient's home, paint a picture of here's where we're going to take you. Here's your outcome. After we discharge you, you're going to be in this type of condition. And empower the patient and empower the caregivers to make that happen. If we're successful in doing that, and we can prove to our referral sources in the community that we're more effective than other agencies in our local communities, then we're going to take the lion's share of the business. Our teamwork has resulted in explosive growth in our company, but we don't look at it as numbers. We look at it as people. We look at it as local people in our communities that we service. And we make no apologies in going after as many people in our local communities as we can, because we think we make a greater difference in their lives. If we accomplish that as a team, we're unstoppable.
Angmar's strength is in our people. We are and will continue to be Angmar strong due to our integrity and compassion. These values define Angmar's mission, a mission that embodies our core belief statement: we serve patients.